what are some of the treatments that we can provide as a sleep physician, as a general physician, for patients who have fibromyalgia and chronic fatigue syndrome. As the disorder leads to no specific direction of a standardized way of treatment, we have to divide into conditions that affect the night, such as insomnia, periodic limited sleep, or sleep apnea, and then conditions that affect daytime function. So, there's a lot of questions always about over-the-counter medications. I'm always asked by the patient, or the patient reads about on websites. And the truth of the matter is that treatment for sleep disorders are used based on standardized treatment, that is, studied with double-blind crossover placebo. So, within the last 15 years, our society pretty much established a committee to look at over-the-counter treatments for sleep disorders. Those includes the antihistamines, are by far the most common. Antihistamines are in the Unisom or in any of the PM preparations, and these are basically antihistamines. There's an area of the brain that promotes wakefulness, and it's the histaminic center. And I'm not going to bore you with a neurologic name, but it's the histaminic center. And histamine is very crucial to promote wakefulness, including reducing fatigue. So these drugs that are used, if you will, over-the-counter sleep aids, which are mostly antihistamines, block that area of the brain that promotes sleep. So for some of the insomnia patients, if you will, Unisom, etc., those PM antihistamines promote sleepiness by turning off that histamine area that promotes sleep, if you will. That is, turns off the awakeful area of the brain. But unfortunately, these are not without side effects due to the half-life of these drugs, as well as the effect on blood pressure and urinary flow, especially in men with large prostate. So once again, they're not without problems and side effects. There's another large category of the herbal over-the-counter, and there are probably too many for me even to discuss. However, I'll give you the traditional ones that our field decided to look into. Valerian root. Valerian root had very little to no effect on the sleep architecture, sleep physiology, or improvement of the depth of the deeper stages of sleep, which is what's impaired in patients with chronic fatigue fibromyalgia patients. So having said that, then valerian has its significant role mostly in reducing anxiety. And it is correct that if you're anxious prior to going to sleep, you will have a component of insomnia. So perhaps if you're trying to manage some of the anxiety components of insomnia, perhaps valerian root may be of some benefit. Melatonin. Melatonin is not an herb, it is a hormone. It is produced by the brain, and usually it starts being produced by the pineal gland, which is a little gland in the brain, which is influenced by light exposure, which we talked about earlier. That if this hormone gets to a certain concentration in the brain, it kind of switches the clock, switches the area of the brain from wake to sleep. So melatonin, if you will, is the hormone that produces a sleep induction in a natural sense. That is, it clues the brain when to sleep. So melatonin is released within 1 or 2 hours of our physiologic sleep, and it almost disappears 1 or 2 hours prior to wakefulness. So if your diagnosis is jet lag or shift worker, that is, if you're misaligned from your internal clock of sleep and wake, such as jet lag, which we've all experienced, or night owls that you want to shift your clock earlier, then melatonin can be used in those individuals. Using melatonin to induce sleep as a sleeping pill is usually not very effective nor efficient. Side effects, usually at normal doses, are very nil, perhaps increased dream content. That never hurt anybody, but it's usually not very effective in ameliorating the complaints of insomnia, and definitely doesn't increase the deeper stages of sleep. So that's in a nutshell kind of a brief summary of the over-the-counter like medications. Now we go back to, okay, so what are the prescribed drugs and how do we manage the symptoms? Very specifically, if it's a sleep disorder such as sleep apnea, and we could go on and have a long discussion about that, which such as the treatment of sleep apnea with a breathing device called nasal CPAP, which is the most effective treatment. That's a whole discussion altogether. But nonetheless, specific treatment for that, and is not a drug. Conditions such as restless leg syndrome, it's pretty established that restless leg syndrome is a drop or a deficiency in levodopa, which is a neurotransmitter of the brain that calms the central nervous system down, that is the motor pathways. So when the levels of dopamine drop in the evening time during sleep, naturally if it drops below a certain critical level, then we have this urge to move, which results in getting out of bed because you feel fidgety, you can't move around, often misinterpreted as a fidgety person or an anxiety individual, but in reality it's a sleep disorder or a movement disorder associated with sleep complaints. Often dopamine agonists, dopamine drugs such as Mirapex, Sinemet are very effective in ameliorating those symptoms. Once again, not a sleeping pill. Periodic movement of sleep, which are involuntary muscle jerks during sleep. Again, these are just true primary sleep disorders seen with fibromyalgia chronic fatigue syndrome. Those are usually addressed very similar to patients with restless legs. It's a slightly different mechanism by which it creates the involuntary leg jerks, but it's the same dopamine levels drop and disinhibit these motor pathways that causes body jerks or leg jerks. The patient often is unaware of them, other than that they say they have unexplained awakenings at night, and at times causes difficulty with sleep continuity. More often than not, they're not aware of that, and often the leg jerks or body jerks are not severe enough that the patients are not, that the bed partner is not aware of them. Now, how about just sleeping pills for patients who have insomnia? It has been well established insomnia, whether they have fibromyalgia or chronic fatigue, has an impairment in function the subsequent day. Same concept of fatigue, difficulty concentration, impairs cognition, focus, memory, moods, executive function. So it is imperative to treat insomnia. Once again, when the insomnia complaints becomes chronic and it goes beyond your general practitioner, that's where your sleep physician can come to your rescue, and at least a consultation and an opinion. Often, the condition is chronic, that is not ameliorated by just behavioral treatment, that is just sleep hygiene. So there's other types of intervention that can be used to treat the insomnia patient, and nowadays it's called the cognitive behavioral therapy for insomnia. That is, it's a combination of both relaxation techniques with further, if you will, mind resetting processes about education about sleep and your misbeliefs about sleep in general. Having said that, there is a large host of medications. Hypnotics have been around in the 70s, starting with the barbiturates, which that kind of predates me just a little bit, and then the release of benzodiazepine, where everybody knows about halcyon and the complications from that, and then Restoril, and then came the new generations. In 1992, in this country, they finally released the new type of hypnotics, and these are the Ambience, the Sonata, the Lunesta, the Ambient CR. These are more selective for sleep, less propensity for dependency and tolerance, and does not alter your natural stage 3-4 sleep, which is the barbiturates was notorious for that, very effective. Tolerance side effects were severe, but had no effect on the deeper stages of sleep. That is, you improve your total sleep time, but the patient never feels rested. And that's the frustrating thing about treating some of the patients with fibromyalgia and chronic fatigue syndrome. You can improve often their total sleep time, and they feel like they sleep longer, but they do not feel rested. Having said that, over the last 6 years and prior to that, a development of a different product altogether, which is called sodium oxybate, which is Xyrem, which was initially and is released and FDA approved for the for the treatment of narcolepsy. It was noted that patients with narcolepsy have a very frequent shift in sleep stages at night during sleep, where we use sleeping pills, and sometimes they feel more alert during the day. Well, we do know that chronic fatigue syndrome fibromyalgia patients have this abnormality in sleep called alpha intrusion. So it is thought that if we stabilize that sleep and we improve the continuity of sleep, less awakenings, and we increase the depth of sleep, growth hormone, that the sense of well-being improves in these patients. So therefore, way back in the 80s, there were a trial done in patients with double-blind crossover placebo, which is really a very effective method of looking at whether the drug does anything or not, and has demonstrated rather impressive outcome. This product is pending FDA approval for the treatment of fibromyalgia, and the outcome measures of improved sleep, restful sleep, sense of well-being, reduction in pain, and increased energy, decreased fatigue have outweighed any of the previous treatments I've seen for the sleep complaints and treatments in patients with fibromyalgia. So there's a lot of promising new research that's pending and new changes that are expected to come around the corner, including new mechanisms of treatment of insomnia patients where sleeping pills as we know it are no longer going to be used. Perhaps this will give us a better insight into not only improving the total sleep time, but without any impairment of alertness function during the day, which unfortunately some of these sleeping pills can do.